a good thing to know a little bit about the career pathway. So more specifically, I'll talk to you a little bit about what led me to public health, what public health is, who's involved in public health, my own science career, and then a little advice for your own science careers. So what led me to public health? All right, someone tell me either through the chat or just unmute yourself. What do these pictures have in common, and what do these people look like they're doing?
We've got some things in the chat.
Got some things in the chat. Let's see. I think because I'm presenting, I can't see them. Does one of the Beloit students want to just read what they are?
Yes, we've got a lot of scientists and people doing science. Sophie made an astute observation that they are all men.
Yes, so that's absolutely right. When I was younger, this was kind of my understanding of science, was a lot of white dudes in laboratories doing complex math equations and kind of removed from real people and real issues. So I'll be honest, when I was younger, I didn't really see myself going into a science career pathway just because it didn't totally feel like something that a lot of young women were invited to or where there was a lot of diversity. But that is not to say that I was not a huge nerd. I was definitely a nerd, and I was very into problem solving, which science is a big part of. And in particular, I had a class called Future Problem Solving when I was in 6th and 7th grade, where each year there was 4 big issues assigned, and we would use a process similar to the scientific process to kind of work through it. So you'd get assigned one of those 4 issues, you'd come up with 16 challenges, you'd pick one to focus on, you'd come up with 16 optional solutions, you'd pick one to focus on, and you'd create an action plan to address your main problem. So how many of your parents make you do chores? And again, I'm gonna look to my Beloit girls to read the chat.
Yeah. Oh, Sophie's lucky.
Yeah.
Lots of chores. Okay. How many of your parents involve you in kind of talking through problem solving discussions of things like global warming or COVID-19 pandemics or violence prevention?
People are saying no in the chat, but Ocean said me, so Ocean says yes. Farah also said yes. Some people say sometimes, but mainly the answer is no.
Yeah, and that's pretty common, right? When we're young, for our Beloit students, we're a little bit older now. Many of you probably qualify as early adults, if not fully adults. But for our 7th graders here on the call, we often do chores, which are good. They give us some life skills, but our parents don't necessarily involve us in the problem solving questions. And one of the things that I'd like to kind of get through with this presentation is that a lot of times we underestimate youth's problem solving skills. And when we talk about career pathways, we kind of talk about it as something that's after college, after high school, kind of way out in the distant future. But there should be a lot of opportunities to involve you in problem solving even now, because many of you have really bright ideas. So I'm going to give one example and hope you guys will kind of participate. So one of the problems this year that the Wisconsin Future Problem Solving put together is called human environmental impact. So I want you to think of a scenario where a city is getting really crowded and there's a need for more housing for people. So they're thinking about building on land that's supposed to be conserved or basically protected for animals, for the environment, for other purposes. So a decision is made to allow developers to build, a big complex for residents, for grocery stores, for things that are needed, but it still encroaches on the environment. So I want you to call out some potential problems with this scenario. What might happen?
Or feel free to put it in the chat.
Yes, and my Beloit facilitators will help me out with what the responses are.
We got a couple already. Animal extinction. Sophie said we would all die. Wow, that's pretty grim, Sophie. Alina is saying deforestation. Ooh, Gabi, a good one. Issues with pollinators like the bees.
Absolutely. So, animal extinction, or maybe less severely, at least an impact on biodiversity, right? As we take over animals' different habitats, sometimes species can't live there any longer if there's too many humans around. And obviously, a worst case scenario would definitely be potential extinction for some species. Yeah, and many of you pointed to other environmental issues as well, including Gabia, the bees is a good one, and one that's kind of a hot topic right now. Deforestation, that's another great one. So again, this is to kind of remind you that even though you're young, you have a lot of good ideas. The other thing that I think is interesting about young people is you're really creative. And a lot of times when you're young, you're willing to share that creativity. Whereas sometimes as we get older, we get a little shy about creating ideas that might seem a little different. And sometimes that's exactly what we need in the world of science. The other thing I was interested in terms of a career was not just something that used my skill sets or my interests, but that connected to my value systems, and in particular, social justice. So when I was a young person, I was very interested in women's rights, very interested in civil rights. So I wanted a career that wouldn't just pay attention to my particular interests, but would actually have some support in advancing social justice and health equity, and public health is a great field for that. And then finally, I'm someone that I get bored pretty easily, and I need a lot of variety and interests. From my Beloit girls, I know the process of picking a major was really hard for me because it meant trying to focus. And I actually took a really different path. I initially designed my own major, which was a lot of work. And then even that became too narrow for me. So second semester of my junior year, after studying abroad, I chose to be a health and society major, which is an interdisciplinary major, which is a fancy way of saying it considers a lot of different perspectives to address the same issues, which I liked a lot because it meant there was a lot of different things to think about and a lot of different ways to think about it. So if you're someone that has a lot of interests and you need a lot of variety, it might mean that the things you're working on change over time. And for some people, that's scary. For me, that's very exciting. And if you're one of those people too, public health might be a good career field for you. So taken together, kind of my own equation for what led me to public health was a passion for problem solving and deep commitment to social justice and a lot of interest and need for variety. All right, so what is public health though? So the first part is probably what most of you are familiar with, that public health promotes and protects the health of the people, right? And we really see that with the COVID-19 pandemic. However, public health is also about protecting and promoting the health of the communities where people live, work, and play, and that means the environment too. So it recognizes that people influence the environment and the environment influences people. And so ideally, when we're searching for public health solutions, we try and find things that think about the safety and the well-being of both people, but also the environments that we live in. All right, this one goes back to you guys. So again, I'll look to my Beloit facilitators. All right, what does this picture look like and how is it connected to public health? What is going on in this picture?
And remember, you guys can always feel free to unmic and shout out some answers as well. Okay, one comment, maybe they locate radiation. Yeah, radiation could be there. That's a good one.
Very good. Is there anything?
Yeah, but
Or they deal with diseases. So somebody else.
Sorry, can someone say that one again?
Yeah, sorry. Somebody else said that they deal with diseases.
Absolutely, right? I think if you guys have been watching any of the medical shows, this looks a lot like what people are wearing for addressing COVID-19, right? So if we have an infectious disease, people have to wear what we call PPE, or personal protective equipment. One of the more interesting challenges that public health people who work on diseases and have to wear things like this, we sometimes don't think about how this intersects with different cultures. And one of the things that I remember from a Beloit college course in, it was called Emerging and Infectious Diseases. There was a case study in Uganda where there was a cultural practice where you would drain the bodies of fluid to bury people. And unfortunately, there was an outbreak in Uganda of Ebola, and Ebola spreads through some of the human fluid. So you had this conflict between public health professionals who were asking people to wear gloves and do all these different things to prevent the spread of Ebola. But then you had a community that was saying, it's really disrespectful for me to wear gloves and do these other things because we need to drain the fluid from people's bodies for them to pass on to the next life that we believe in. So sometimes public health professionals have to work really closely with the community to figure out how do we find a way to protect people while also trying to be respectful of different cultural beliefs. Okay, I'm going to put up another picture. What do we see going on in this picture, and how might this be related to public health? And there's no wrong answers here.
Rebecca says watering. Yep, that looks like it.
Absolutely, it could definitely be watering, right? Watering crops to grow food for the community. What else might it be?
A couple people think it could be spraying the crops with some chemicals. Something related to the environment is another guess.
Absolutely, right? So this could be water and it could be chemicals, right? So we could be helping the community and the people, or we could be doing something that potentially helps keep pests away, but maybe has some environmental and human health issues as well. But again, I remember a case study that complicates it, and this often happens in public health. I used to work at a fair trade store in college, and we would sell fair trade chocolate. And someone asked my boss one day, "Is this organic?" And my boss's reply was, "It's organic as it can be." And the whole idea was that the chocolate industry was so important to the Ghanaian economy that if pests were a threat and it looked like it was going to decimate the cacao plants, they would spray occasionally just to make sure the plants were enough to keep the economy going. And so again, this is like a classic public health situation where sometimes what's best for the protection of people or the environment has a negative impact on the economy. So you often end up working with different partners to kind of say, how can we do both? And this has happened with COVID too, right? We had a lot of businesses that initially had to shut down as we thought about the spread of this disease. And it was challenging because on the one hand, you really felt for these businesses. And on the other, some of them, the way that their businesses were set up was a huge threat for COVID spread. So it can be really complicated to work in public health sometimes. All right, and we'll go to my last image. This one's a little trickier, but it's an important one for how we think of public health today. So what's going on in this image and how might it be related to public health?
One student says graffiti.
Graffiti, yeah.
Another student's asking if it's on a train.
Oh,
or a wall.
For sure.
One student said freedom.
Freedom?
Yes.
Yeah. Okay, so these are all really good, interesting observations. This is a place that I used to like to go in Milwaukee when I lived there, and it was a weird intersection between kind of green space and nature with like some things that indicate that you're in a city and you're in an urban area. So on the one hand, for some people, graffiti is a form of art, right? And you could think of this as a place where people come together to chill out in nature, but also appreciate art that the community has put together. But graffiti can also indicate gang territory. So it could also be a place where for some people, this suggests exactly the opposite of what it might mean for some in terms of a lack of safety or a threat, instead of a place to kind of relax and unwind. So again, public health can be really challenging in the sense that depending on who you are and what's going on, it can kind of come across really differently to people. Great answers though. So kind of taken together, public health can include many different things. And I want to think about COVID-19 a little bit with these different roles. So what kind of things have researchers been working towards to stop COVID-19?
I think they researched like about the virus for vaccines and all of that, and just like cures.
Yes, perfect answer, right? We want to stop this thing. A vaccine is one of our main tools, but vaccines work in different ways. And we've seen that with some of the different ones that are out. So we need research to tell us, what does the vaccine need to look like in order to stop the virus spread? It's a great answer. With evaluation, that means doing things like asking ourselves, are the vaccines actually successful? Is this actually working to stop the pandemic? Surveillance is kind of a fancy word for monitoring data in a regular way. Some of you may have been following COVID-19 data dashboards, which tells us consistently how much disease is in our community. So for Madison and Dane County, where I work, our agency has a data dashboard, and every day you can see how many cases are coming in, how many people are vaccinated. This is the kind of information that surveillance can contribute to that lets people know what it looks like in our community at any given time. Prevention is kind of exactly what it sounds like, right? Preventing the spread of COVID, like some of you just spoke to. Emergency preparedness is usually not a big deal, but obviously in a pandemic it is. And it's hard, right? Because in the years leading up to the pandemic, in terms of funding, you saw a lot of disinvestment in preparedness work. And then when this pandemic started, you guys saw the fallout of some of that. We didn't have enough personal protective equipment for nurses and doctors. We didn't have enough of a lot of things. And it's hard because we often don't know when emergencies will happen, right? That's why they're emergencies. But if we don't put some funding into them, we're also not prepared to address them. And the lack of PPE for a lot of doctors and nurses was really scary in the beginning. Intervention, right? That can be vaccines, that can be contact tracing, which we'll talk a little bit about in the lab today. Education can be everything from, how to wash your hands so that it really does help you not spread, to a lot more like intensive education for folks that want that level of detail. And then policy, and this has been a big one for COVID-19, it's passing either kind of permanent or temporary laws. So many of you might live in communities like mine where we've passed a number of public health orders that limit like where you can go and what you can do. And that's to limit the spread of the virus. Okay, so how many of you guys like worms or vampires? Yeah, me too. But leeches, which are like kind of like blood-sucking worms, are a little gross, and they're not as cool as worms or vampires. So when public health started, there was a lot of medical treatments that today we know are not very effective and are kind of gross. And we've come a long way from that. And when we talk about public health, we kind of have 1.0, 2.0, and 3.0 that grow over time. One of the first things to come out of 1.0 was good hand hygiene and vaccines. So again, it's funny because before the pandemic, these were things people didn't think about a lot anymore, but obviously they still have relevance today. So it's not that we've moved on necessarily from 1.0, but we've built on it. Okay, 2.0, what pictures do you guys see? What are we focused on in 2.0?
Oh, I think this is what is it called? Diabetes, something like to represent diabetes.
That's exactly right, checking for diabetes. So in Public Health 2.0, we got really interested in chronic diseases. So things like diabetes, hypertension, which is high blood pressure. And a lot of talk was around obesity, but it wasn't necessarily the weight that mattered. It was the chronic issues that went with it. The other content area that was really big was HIV/AIDS. And a lot of you were too young to kind of be around when this was a huge problem, but not unlike COVID-19, it was very scary when it first came out because we didn't know what was causing it. We didn't know why it was spreading, and we didn't know how to stop it. All we knew was that it had a very high mortality rate. And in fact, at some point, it was kind of, they thought that it was just like a death sentence. And we've come a long way from that. But yeah, public health 2.0 was kind of recognizing that between the chronic issues we see a lot of, especially in America, and the HIV/AIDS epidemic, there was a lot more like funding and things we needed to do for prevention because clinicians were getting a little overwhelmed with how much they were being asked to treat. So today we're in public health 3.0, which in many ways is just making things super complicated, but super interesting. One of the main focuses is something called social determinants of health, which is a very fancy way of saying things like housing influences our health, food security or having enough food influences our health, access to healthcare influences our health, having access to transportation influences our health. So it's thinking about these big systems and the way that they contribute to health at the population level. So not just individuals, but kind of people as a whole. And related to that, it talks a lot about both health disparities and health inequities. Health disparities kind of get at differences in populations. So we might say that cancer is more prevalent in one population than another. Inequities acknowledge that some of that might stem from different accesses to different resources and opportunities, in which case it's not just a difference in health, but it's actually linked back to some inequalities that exist. And then finally, cross-sector relationships, another fancy word, but basically it's saying that with these huge problems that we're facing, we need a lot of different people and a lot of different perspectives to get to solutions that will actually be impactful and will work. So public health, you'll often see us working with all sorts of different people. So doctors and nurses, yes, but also social workers, also people in community organizations, people in businesses. We have all sorts of partners because they have a different set of skills and interests potentially, but ultimately we come together to kind of work on the same big solutions. Okay. Again, another fancy word, but we're going to break it down and make this easy. So this is a tool we use a lot in public health. It's called a social ecological model. And what it does is it allows us to kind of see all these different things that influence the public health problem. So today, for a more simple example, we're going to use the issue of obesity. But I think what I hope you take away from it is that this issue will tell you it's a lot more complicated than it might initially seem. So who can tell me some individual things that contribute to obesity? So I want you to think about knowledge, attitudes, behaviors, things you do.
One student is saying glucose. That's pretty fancy. Wow.
That is very fancy. Yes, glucose levels, absolutely. Okay, what else at an individual level might influence obesity?
Stress is another response we're getting right now.
Stress is a big one, right? Stress and trauma potentially. Yep.
Eating is another one.
Yep, your eating habits. What goes on with eating habits usually that contributes to?
Claire says genetics.
Genetics, absolutely. Right? People come in different shapes and sizes. Not everyone is meant to be a little person. Okay, we'll move on to the next one. So interpersonal is a fancy way of saying the relationships around you. So what kind of relationships and who might have an influence on obesity?
Someone said family members.
Family members, absolutely. This is a big one, right? Especially if there are connections to traditions, right? If there's certain ways your family likes to eat and it's a big part of socializing, absolutely. Who else might influence your eating habits or obesity in general?
A couple of people are saying yourself. And Abby said, what's available near you? And Rebecca said, friends.
Yeah, absolutely. So friends and yourself. Yep. Yeah, and your relationship with yourself, right? Okay. We'll move on to kind of the physical and built environment. So when I say physical environment, I mean kind of the grass and the air and kind of the natural environment around you. The built environment is kind of like, when you think of a city, it's like the buildings and the houses and the sidewalks, the things that are man-made but are integrated into your environment. So what are some things related to the natural and kind of the built environment that influence obesity?
I said that I have apple trees in my neighborhood and I steal apples off of them.
Yes. So whether or not your neighborhood has access to fresh produce, some have community gardens, right? That makes it a little easier to have access to healthy food. For sure. What else? What might prevent someone from exercising in a neighborhood?
One student is saying that if you stay in your house too long, it can be a problem. And another student said if like your neighborhood isn't safe, maybe to go outside.
Those are really good answers, right? So some of it could be you. You might like to be someone who's a little bit more indoors and you stay in the house. But it can also be your neighborhood. If you don't feel safe in your neighborhood, exercise becomes harder. Also, if your neighborhood is near a highway or it's near a place that has a lot of pollution in the air, it might feel gross to exercise because it might make the air that you're breathing might bother, especially if you have asthma or another condition. So yeah, there can be a lot about where you live that influences your ability to, again, have access to healthy food, your ability to exercise, all these different things. What else in terms of, we'll move up to the community context and we'll talk a little bit about social norms. So again, kind of a fancy way to say what the people around you believe and like the things that they like to do, what might influence obesity in terms of community norms or kind of the people and the context around you. What kind of restaurants do we have a lot of in the United States?
Fast foods.
Fast foods, that's exactly right. And they tend to be cheaper, right, than some of the healthier food. So in America, we kind of have a system set up where not only are fast foods pretty addictive because they have high ratios of salt, fat, and sugar, they're fast, which a lot of people need, and other options are often more expensive. So as a social norm in this country, fast food is it's part of our culture. And it's part of the kind of food people from America are known for, right? People often think of America and they think of McDonald's. So that's a great example, is fast food. Good job. And finally, we'll move on to policies and structures. So this one's a little more challenging, but I think you can do it. So think about some laws or some bigger structural issues that influence obesity. My bullet students can jump into.
I don't think this is like a law, but because of global warming, it's like pollution, like pollution just basically in general, could be a policy, like something, I think.
Yeah, absolutely. Different contaminants and pollution in your environment definitely influence kind of the food you have you have access to, and that actually, so when I lived in Milwaukee, we worked on an issue where they found a lot of lead poisoning in the soil. or I'm sorry, a lot of lead in the soil that led to lead poisoning of a lot of the kids in the neighborhood. And the solutions can be pretty simple. Like if you use a raised bed and you put in new soil, that kind of gets at the issue. But if you don't know that, right? So then you have an intersection with education and what people already know. Yeah, you're potentially growing food with contamination based on, like you said, either chemicals or pollution in the environment. This is a pretty big concept, but we just talked about fast food, and there are actually different zoning laws that some companies will target low-income communities of color and put lots of fast food into those neighborhoods, right? And so again, then if you have more access to that kind of food and you've kind of been a target, same with the media, right? When we see lots of advertisements for unhealthy food over and over again, that's a big picture issue that can influence individual behavior. So you all have done an awesome job, and I hope this kind of gets you to think about the fact that when we take a public health issue, a lot of times as a society, we focus on individual behavior without recognizing that there's lots of things that are influencing it, and it's often a lot more complicated than we initially realize. Okay, so won't spend a lot of time on this because we kind of have been over this a little bit, but there's a lot of different people that are involved in public health. So you guys have heard about researchers and data analysts, especially with COVID-19. They give us the information to know what's going on with the disease in our communities. We'll talk a little bit more about epidemiologists because they've been critical to COVID-19 especially. Government employees can include researchers, data analysts, epidemiologists, and a lot of different roles, a lot of direct service as well. Health and restaurant inspectors, right? Foodborne illnesses are pretty gross. So health inspectors can help make sure that food is sanitized in a way that we don't get people really sick. Same with infections at hospitals. There's a number of kind of hospital-borne infections that can travel pretty easily if sanitation isn't kept up. Health educators. So again, you can think of COVID-19. People are helping to educate people on how to not spread the virus and what to do to prevent it. Urban planners are a little bit of what we just talked about with obesity. So they might say, this community doesn't have enough parks and it doesn't have enough access to healthy food. So we're going to build a community garden that'll address both the need for more nature and green space in the community and will give us healthy access to food for the neighborhood. Social workers are another good partner for us, along with public health doctors and nurses. So again, this is just a small list of many, many people that public health will work with. So I want to go over this just really briefly because this is so critical to COVID-19 and the vaccine development. So epidemiologists, my friend calls them disease detectives. So they study the distribution and the determinants of a disease or health in a population, which is, again, kind of big words to say who is getting affected by the disease, where and how is it spreading, what's causing it, how do I stop it? Is this normal? Is it or is it above what we would expect? Okay, so we'll go back to some interactive stuff. These are some famous faces of public health to remind you that this is kind of embedded into our culture and it's not so fancy in nature. So who is this lady and how is she connected to some public health work?
I'm not sure, but is that Michelle Obama?
That is Michelle Obama, yes. And what does it look like she's doing?
Dancing, keeping fit.
That's right, she's dancing. So Michelle Obama has done a ton for public health work. She has a Let's Move movement. She's done a lot of community gardening with kids. So she was kind of always in the public eye, pushing these messages about how we can stay healthy. How about this lady? Who is this?
Selena Gomez.
Selena Gomez, absolutely. And what does Selena Gomez talk about in terms of health issues?
I'm not sure.
Okay, so Selena Gomez has done a lot of discussion about this disease she has called lupus, as well as mental health, right? And she kind of talks about access to mental health for lots of different people. She created a foundation and she does a lot to destigmatize mental health, which again is a fancy way of just saying sometimes people are a little shy or nervous to seek out mental health support. So she's been a celebrity that's done a lot to say, like, it's important, it's part of your health, just like your body. Go in and get the help that you need. And how about these two? Who are these guys?
Is that Prince Harry and who is that other person?
Yes, so this is Prince Harry and Meghan Markle. And during COVID-19, the pandemic, they have done a lot to educate people about the virus. I think at one point they were testing people by swabbing people's noses. They've brought food to people that need it and that we're isolating and quarantining. So sometimes with public health, it doesn't always work to have the scientists as communicators. Sometimes we need a little help from famous people to kind of make it normal, right? And to help people say, okay, this is someone I know and trust. I see them on TV, I see them in politics, whatever it may be. So they do some public health education that really kind of helps make it understandable and a priority for people. And within science, the face of public health is also starting to change. So this is one of my science crushes, which is basically a way of saying like a public health hero or someone that is just like a total rock star. Mona Hanna-Attisha was someone that called out the lead poisoning and the Flint water crisis in Michigan a few years ago. She also has a great quote, and I'll read it just because I think it does a really nice demonstration of the difference between medicine and public health, which people often confuse. So she says, I kept thinking about the difference between individual health and population health, treating one patient versus treating many. A doctor might see an individual child with an elevated blood level, so that's indicative of you might be lead poisoned. But it would take a study of many patients, a population, to figure out what's happening to all the kids. If one doctor alone could see all the Flint kids, maybe that doctor could start to make helpful connections. But with so many doctors in our clinic and throughout the city at other clinics, that connection doesn't usually happen. Each doctor might see a few cases that are a little higher than normal, but they wouldn't be able to see it as an epidemic by themselves. This is why training in public health is so critical for all physicians. We need to be able to step back from the individual patient and look at the bigger picture. So one of the differences in medicine and public health is doctors and nurses will treat individual patients as they come in. Remember when we talked about disease detectives of epidemiologists? So we look for patterns at bigger scales of people. And again, the pandemic does a really good way of highlighting this, right? Like we wouldn't call it a public health pandemic if this was just affecting a city in Kansas and it wasn't going anywhere else. But COVID is something that has spread all across the country. And so we've been able to look at the patterns in many, many different people that constitute the American population. In this case, right, the pandemic is actually global, so it's all around the world. Unfortunately for the United States, we are the #1 still. Okay, so another cool lady is Nadine Bergeris. How many of you guys have heard of trauma? Yeah, so trauma is a really big concept. Nadine Bergeris talks about adverse childhood experiences, which are a lot of different kinds of trauma. And one of the things she looks at is the higher number of adverse childhood experiences, so kind of different forms of trauma that you've experienced as a kid, it has influence on your life well beyond childhood. So you can see kind of here experiencing 4 or more what we call ACEs, kind of different forms of trauma. It's associated with increased risk of heart disease, stroke, cancer, COPD, diabetes, Alzheimer's, and suicide. So she has done a lot of work to prevent these and work on addressing them in childhood so that it decreases the impact as people get older, because we know that these experiences directly affect people's health well beyond childhood. Maria Isabel Rodriguez, she was one of public health's heroes of the Americas, so both North and South America. She was the first woman minister of health in El Salvador. And currently, she's a presidential advisor on health and education and working to achieve universal health coverage and basically health equity. And then finally, this lady is very cool. She's one of my most recent science crushes. She is a 67-year-old Hungarian woman who her work on messenger RNA is one of the reasons we have our Pfizer and Moderna vaccines today. And if you guys haven't read, I might have the Beloit girls send this out. New York Times just wrote an article about how she really struggled in research. She kept, the grants kept running out, but her mentors believed in her kind of wacky, innovative ideas. So they kept keeping her on and finding ways to keep the work going. And obviously it paid off, because even though she's almost 70 years old, she is now a public health hero and has created one of the most groundbreaking developments in science, probably of our lifetime. So to kind of sum up, and this is my own super nerdy joke, I like to say we've gone from Jon Snow to Maypo. So in the beginning, we kind of had a lot of white men in the field of science. Jon Snow is considered one of the founders of public health. He mapped this cholera outbreak in the UK, where he talked to lots of people and figured out where they were getting this disease of cholera from. And today, Maypo is a very well-known scientist who maps all sorts of different health issues, but obviously looks a little bit different from John. So we've definitely diversified the field a little bit more, and it's a great thing to see. The other thing I would say, since you're all girls, is that it can be really important in science to have female and women mentors. It can be kind of a male dominant field still. And even though we're making progress, I have found it really helpful to have strong women who are very invested in the field of science to be kind of guiding mentors over the course of my career. This lady, Marianne Fass, was my mentor at Beloit College. One of the things that cracks me up about Marianne is that she was obsessed with viruses. She actually had stuffed animal viruses. And yeah, no, I see some of you laughing. She was obsessed. And she was also obsessed with the flu. And when I took one of her courses, Emerging in Infectious Diseases, we were all pretty bored after like a month. We were like, Marianne, this is the flu. Like, we want to study Ebola. We want to study the really interesting ones. And she was like, listen, if there's going to be a pandemic in my lifetime, it's almost bound to be related to the flu and to be a virus. And I have to, as your mentor and as your advisor, I have to teach you all the fundamentals of viruses, because as you go out into the world and become, invested in your careers, this is going to be really important. And so sure enough, literally 10 years after she talked about this, a friend and I, who also had Marianne as an advisor, we both worked together at the health department, and we've been working on COVID for the last year. So as much as it was kind of boring to work on flu for that long, she was absolutely right. This is the pandemic we're dealing with, and those virus fundamentals were critical. Okay, so after Beloit, there was a few different things that I did in my public health career. So I went to Washington, D.C., and I did a couple of internships. I took a research path and did a PhD, which I'll talk about. I stayed on and I did this research fellowship and instructor position. And then today I'm a public health supervisor at a local health department. So when I went to Washington, D.C., I did 2 internships, one in women's health and one in health policy, which is kind of understanding how law influences policy. But I did something else that's probably a little more interesting to you guys. So when I was at Beloit, I was well known for being a dancer, as well as a lot of other things related to my schoolwork, obviously. And Chris Johnson, who is the dance teacher at Beloit, we were both really interested in dance and social change. And some of my colleagues at one of my internships, they found out about this through just casual conversation. And they asked me to lead a flash mob on the National Mall to bring some attention to Equal Pay Day. So we joined with another organization. We had over 100 people that did this. The video went viral and became the most watched video of our organization. And it was really nice. I was a very young intern, but it was a fun way to kind of communicate issues in a different way. So my point here is I really like creative communication and advocacy. Sometimes it requires thinking outside the box to get your message across. So as you guys move into career fields, talk to your coworkers, because even if something seems unrelated, they might find a way to bring it into your job, and something really creative like this could result from it, where you're suddenly dancing about the need for women to be paid as much as men. Okay, so when I went into the field of research, I didn't just want to be in a classroom for the 6 or 7 years that a PhD takes. I was really interested in having a program that wanted to advance social justice and that had community really strongly involved in the research. And I was lucky to find that in Milwaukee. So the kind of research I studied, again, fancy term, simple concept. It's called community-based participatory research. So basically, the community you're working with, if they're influenced by some kind of public health issue, they probably have a form of expertise that you don't because they live there. And so CBPR basically says researchers have kind of a nerdy and methods interest and expertise, but the community needs to kind of be the ones to help design and figure out what to do about it because they're living that experience every day. So for me, when I was finishing my dissertation, to do my dissertation, which is a big research project, I actually had 8 youth ages 13 to 17 that were my partners. So they helped design the research. They helped come up with the methods we were going to use to do it. They helped collect the data. They helped analyze the data. And then they weren't super interested in giving a PowerPoint presentation. They thought that was kind of boring. So they used things like rap and slam poetry and skits and drawings to share the data back with the community. And since the community included a lot of other youth, that was a really impactful way to get kids interested in what was going on. So today I am at a local health department. I'm a supervisor, one of 2 in a division of about 25 people. The agency as a whole is closer to 150. And I do a lot of different things. I oversee our violence prevention unit, our evaluation team, our policy team, and then for the county of about 600 people, we do this big community health assessment and community health improvement plan. And if that sounds like a lot, it is. So I drink a lot of coffee. But one of the benefits is I'm also a boss. I like to say literal and figurative, but at least in this case, literal. I really love my coworkers. They make it easy to be a leader. And given that we've been in this pandemic for a year, that's been really critical to have other coworkers who are super nerdy, super committed to social justice, really committed to public health. So even though it's a lot of work and I work a lot, it's worth it. During COVID, which has been basically a little over a year for us now, I manage the community liaison team. So there's a lot of different people that have been confused by COVID, including kind of as it's evolved and changing orders. So the liaisons work with people like folks in housing, people that work at food pantries, people that work in businesses, people that work with healthcare systems, people that work with the emergency responders like police and firemen. We help make sure they understand the orders as well as what they need to do to help protect the community. I also work with our after action report team, which basically thinks about how we're responding to the virus and says, what are we doing well that we should keep doing? What is not going so well that we need to change? And then how do we actually change it so that we have a better impact? And then finally, I'm part of the planning team. So one of the things we're considering as case counts go down a little bit and vaccination rates go up is how do we keep testing going, knowing that it influences what we know about the disease, but might not be as important as vaccines. And then within vaccines, there's kind of 2 different ways we're approaching it. One is, the need to vaccinate lots of people. So we have mass vaccination clinics. And the other is mobile vaccination, which kind of brings the vaccine to the people. So it might be a community organization, it might be a church, but basically creating an easier access to people getting vaccinated. So again, right, on the one hand, being in public health lately is kind of like being a celebrity. And in working for a city county health department, I've worked a lot with the mayor and the county exec this last year, which is kind of powerful, right? You feel like, wow, like I didn't expect to be this age and having the mayor listen to me about what my ideas are. At the same time, This is also what it feels like, right? For the last year, I've been working like 50 to 70 hours a week because we're in a pandemic and people are looking at the public health department to tell them what to do. So it can be very tiring. There's a lot of people that haven't liked the public health orders because of what it means they can and cannot do. My director's gotten a lot of death threats in the last year, and a lot of health directors around the country have quit. So it's interesting, right? Because it is kind of like being a celebrity in the sense that you're in the spotlight, and there's some good that comes with that. There's also a lot of downsides and some people that don't mind telling you what they don't like about you. So my kind of final pieces of advice for you, find work that interests you, but also that connects to your value system. When you talk to older people about how a job becomes something you love instead of just what pays the bills, it's often that they've found something that doesn't just build on their skill sets and their interests, but actually aligns with what they believe in and what they kind of want to see for the world. Find female mentors who inspire you and try and learn from them and stick with them. Be creative in your science communication to connect with different audiences. We've seen this a lot with vaccine hesitancy, right? There's a lot of reasons people are scared of the vaccines, and not everyone is going to respond to the science or the messaging that might make sense to a lot of different people. So get creative with how do you connect with different kinds of people who might have different beliefs and might need to hear something or see it in a different way. And then for this last one, I think it just says you're problem solvers even now. And this goes back to kind of the start of the presentation with you all have a lot of really good ideas. And as much as I want you to be thinking about your science career pathways, I hope that you see more adults engaging you even now, because when I did my research dissertation with 13 to 17-year-olds, I learned a lot from them. And that was really important to making that research successful. So don't discount what you already have to offer. Okay. Any questions? And I'll stop presenting